Hello everyone, and welcome to Highlight. Do you know in how many ways people can get infected with the novel coronavirus? Aren't you frustrated with the amount of misinformation spread over the internet and social media about the COVID-19? Then stay with us to explore 12 myths about the coronavirus debunked by the scientific facts and evidence. Myth number 1. 5G mobile networks spread COVID-19. While viruses can't travel on radio waves or mobile networks, in fact, this virus is spreading in many countries that don't even have 5G mobile networks. First, let's see how it spreads. It mainly spreads from person to person among those in close contact. This human-to-human transmission is, in most cases, through the small respiratory droplets released from the nose or mouth when a person who has COVID-19 is coughing, sneezing, exhaling, or even talking to someone within about 2 meters or 6 feet. These droplets land on nearby objects or surfaces which are then touched by others, who may at some point touch their mouth, nose or eyes and become infected. Similarly, you might get the virus directly from a person with COVID-19 if you inhale their respiratory droplets or if, for example, these droplets reach your eye when the infected person is talking to you. Evidence shows that the virus can also be spread to people by those who are infected but are pre-symptomatic, that is, they haven't yet developed symptoms, or asymptomatic, that is, they never develop symptoms. And also, keep in mind that COVID-19 can have a long incubation period and the infected person may not show any symptoms for up to 14 days after exposure to the virus. These are the reasons why it is crucial to practice proper social and physical distancing if you really have to leave your house during the COVID-19 pandemic. It's recommended to stay more than 1 meter or 3 feet away from others in public, and some health experts even advise people to keep a minimum physical distance of 2 meters or 6 feet apart to stay safe. So, no, 5G mobile networks don't spread coronavirus. Myth number 2. Antibiotics can be used to prevent or treat COVID-19. To debunk this myth, first we need to know what exactly coronavirus is. Coronaviruses are a large family of viruses named for their appearance under electron microscopes. They have protein structures or spikes on the surface that make them look like a crown, which in Latin is called corona, hence the name coronavirus. Some coronaviruses can cause illnesses in animals and humans. Rarely humans can get infected by animal coronaviruses, which may then spread to other people. In humans, some of these viruses cause typically mild respiratory illnesses similar to the common cold. But these viruses have also been associated with more severe diseases, including the severe acute respiratory syndrome SARS and the Middle East respiratory syndrome MERS. The newly identified coronavirus called SARS-CoV-2, or the novel coronavirus, is responsible for the outbreak of the infectious respiratory illness which is called COVID-19. COVID-19 stands for the coronavirus disease of 2019, and the outbreak began in Wuhan, China in December 2019. In March 2020, the World Health Organization declared COVID-19 a pandemic, and the situation is evolving daily. Antibiotics can't cure or prevent COVID-19 because they only work against bacterial infections, and COVID-19 is caused by a virus. However, some hospitalized COVID-19 patients might receive antibiotics for bacterial co-infections such as pneumonia. Myth number 3. The flu vaccine can protect you against COVID-19. You might say, I got a flu shot, so I'm good. No, you're not. The flu vaccine is effective against the influenza family of the viruses and doesn't immunize your body against this particular coronavirus. So far, no vaccine or antiviral medicine has been developed to prevent or treat COVID-19. However, a lot of research has been dedicated to find a vaccine or treatment, and some possible options are under investigation. Myth number 4. Eat garlic to prevent catching COVID-19. Well, garlic is a healthy food that may have some antimicrobial properties, but so far, there has been no evidence from the current outbreak that eating garlic has protected people from this virus. Myth number 5. Rinse your nose regularly with saline to prevent infection from the new coronavirus. While rinsing your nose with saline might help recovering more quickly from the common cold, there is no evidence that it can help with the respiratory infections such as COVID-19. a lot of people are interested in traditional or home remedies. Although some of these remedies may provide comfort and help relieve the symptoms of COVID-19, there is no evidence that such remedies can prevent or cure it. Myth number 6. The novel coronavirus only affects older people. Younger people are safe. This is also not true. People of all ages can catch COVID-19. Older people and those with pre-existing health issues are just more vulnerable to becoming severely sick if they get infected by the virus. Myth number 7. You may get it through a mosquito bite. Wrong. There has been no evidence so far on transmission of this virus to humans by mosquitoes. Myth number 8. Take a hot bath to protect yourself against it. Taking a hot bath doesn't increase the internal temperature of your body no matter how hot the water is, so unfortunately, it won't prevent catching COVID-19 and won't kill the coronavirus inside your body. Myth number 9. The new coronavirus dies in snow and cold weather. No, there is no reason to believe that cold weather can kill this coronavirus or other diseases. The normal human body temperature remains around 36.5 to 37 degrees centigrade regardless of the external temperature or weather conditions. In fact, the COVID-19 virus can be transmitted in all areas of the world with all kinds of climates. Myth number 10. Drinking alcohol can kill the coronavirus in your body. Wrong. Frequent or excessive alcohol consumption can in fact increase your risk of health issues. Myth number 11. If you can hold your breath for 10 seconds or longer without coughing or feeling discomfort, you don't have COVID-19. That is also not true. Infection with the coronavirus is diagnosed based on the symptoms and can only be confirmed with a laboratory test known as PCR or polymerase chain reaction. You can't confirm it with a breathing exercise. Speaking of the COVID-19 symptoms, let's see what they really are. The most common symptoms of COVID-19 are fever, fatigue, and dry cough. Other symptoms include muscle aches, runny nose, sore throat, nasal congestion, unexplained loss of taste or smell, headache, diarrhea, difficulty breathing, and pneumonia in the lungs. However, not all COVID-19 patients show all these symptoms, and some patients even remain asymptomatic. That is, they never develop symptoms and don't feel unwell. Although, for many COVID-19 patients, the symptoms are usually mild, this disease can lead to serious respiratory problems, kidney failure, and death in most severe cases. In fact, around 1 out of every 6 COVID-19 patients becomes seriously ill and develops difficulty breathing. Myth number 12. If you catch the new coronavirus, you will have it for life. No, most patients will recover and eliminate the virus from their body. However, while about 80% of the people who get the COVID-19 recover from the disease on their own without needing special treatments, the risk of developing serious illness is higher for older people, typically over the age of 65, and those with compromised immune systems or underlying medical problems such as heart conditions, diabetes, high blood pressure, lung disease, and cancer. The general advice is that if you have a fever, cough, or difficulty breathing, you should call your doctor and seek medical attention. So, what can we do to protect ourselves from COVID-19? Number 1. Practice proper personal hygiene and hand washing. Regularly wash your hands thoroughly with water and soap for at least 20 seconds each time, especially after using the bathroom, before handling food, and after touching objects such as doorknobs and handles, countertops, elevator buttons, light switches, shopping trolleys, and card payment machines. If soap and water are not available, use a hand sanitizer with at least 60% alcohol to clean your hands. Number 2. Avoid touching your eyes, nose, and mouth. Depending on the temperature, type of surface, and humidity of the environment, the coronavirus can survive for 2 or 3 days on some surfaces. Your hands may pick up the virus from these surfaces and transfer it to your body through your eyes, nose, and mouth. So if you touched any surfaces in public, it is recommended that you avoid touching your face before washing your hands properly with soap and water. Number 3. Practice respiratory hygiene. Cover your mouth and nose while coughing or sneezing with the bend of your elbow, or use a tissue and then throw it immediately in a closed bin. Then wash your hands. Number 4. Stay at home and avoid social gatherings. To protect yourself and reduce the spread of COVID-19, stay at home as much as possible and avoid gatherings in groups. If you have to go out, for example to buy groceries or to work, do so while practicing proper social and physical distancing and hand washing measures. After coming back from the grocery store and handling and storing the purchased products, wash your hands thoroughly. Wash the fruits and vegetables with clean water the same way you would in any other circumstances. Number 5. Avoid physical contact with others. To protect yourself and others, avoid greetings that include touching others, like shaking hands or hugging. Instead, practice safe greetings such as a wave, a nod, or a bow. And what should you do if you or someone in your home becomes ill? If you begin to feel unwell and even experience mild symptoms of COVID-19, such as a headache or a slightly runny nose, stay at home and self-isolate until you recover. Do not go to work, school, or other public places. Rest, drink lots of fluids, and eat nutritious food. However, if you develop a fever, cough, and difficulty breathing, seek medical advice from your healthcare provider, but call ahead to get directed to the right medical facility and prevent possible spread of the disease. If someone under your care has symptoms or is confirmed to have COVID-19, wear a medical mask when attending to the sick person. Practice proper hand hygiene, especially after any kind of contact with them. Clean and disinfect the surfaces frequently touched by them. Use dedicated dishes, cups, eating utensils, towels, and bed linen for the sick person and wash them regularly with soap and water. Monitor their health and call your healthcare provider if their symptoms get worse or if they experience difficulty breathing. So there you have it. How you can protect yourself against COVID-19 and the 12 myths about it you shouldn't pay attention to. If you've heard of any other myths about COVID-19, let us know in the comment section below. Share this video with everyone to raise awareness of the best ways to protect yourself and others during this pandemic and stay away from the myths. Also, don't forget to subscribe to our channel for more videos like this. Stay safe and wash your hands.